So let's take a moment and jump into some of the questions that you asked us prior to the webinar itself. And I do want to tell you that as a reminder that these webinars are recorded, and we actually are going to send you an email as a follow-up to this webinar where you'll get a copy of a link to the YouTube recording of this video, the slides in flipbook presentation format, and also some sponsor discounts that are there. So it's something that can really help you. And naturally, if you have any questions about your health or you have any medical issues, get a hold of your medical doctor, your medical cannabis doctor, or your medical cannabis practitioner. So that being said, Michael, let's jump into some of the questions that were asked prior to this particular webinar. First of all, do edibles help with arthritis and joint pain? And my answer is absolutely. Your thoughts on that, Michael? Because you do have some joint pain. Is that correct?
Yes, sir. Edibles definitely help. Coast will definitely help ease your pain through the day. There's a wide variety from gummies, tinctures, capsules, and they definitely help with the inflammation, help with the pain, and just help you coast through your day at ease and get more relief.
Now, I think, again, the one thing I like to caution people about is that edibles take a while to work. They could take up to 2 hours, and it's not uncommon for an edible to take an hour to an hour and a half. So my whole counsel when people are talking about edibles is just be cool. Use them. If they don't work after about 15, 20 minutes, just be cool. What you don't want to do is go popping these things like Skittles, because after 2 hours or 3 hours, you'll begin to feel it. And it's not necessarily the feeling that you necessarily want to have. You may be a little woozy or drowsy or something like that. The answer is yes, absolutely. And I think it's something to try. I do use edibles. For example, I'll take one just before lunch. It'll take me through the afternoon and into the evening, especially on the days that I practice martial arts. So on the days that I have my martial arts training, that's what I use to be able to get ready and be able to not have the joint pain when I'm doing all the kicks and the moves and things like that. Let's jump to the next question. That is, how do you know what you get at the medical dispensary? Michael, this is right up your alley. The COAs are really the key to this whole thing, right?
Correct, Mark.
By the way, COA is Certificate of Analysis.
So, yes, exactly as Mark said, the certificate of analysis or your COAs, these are what highlights all the terpenes that are in the products. You can pull these off of our website. Of course, if you ever get a product, you can scan these on your product after you check out. I would recommend, looking into those before you purchase your product, just so you can gear your benefits to the specific terpenes. And then, of course, you can always ask your staff, your bud tenders. We can pull all this information up at the register, and it really helps you get the best bang out of your product.
Sure. And I think, again, the websites of the dispensaries like Air will give you all the products that they have. But then when you want to know what's in those products, Air actually has the COAs online, which is unique. There's not a lot of dispensaries that do that. And I want to compliment Air for being able to do that. It really helps people understand, especially the terpene profiles and the cannabinoids that are in the product that you're looking for. Michael, let's jump on to the next question, which I think is a great question. Can I use cannabis to manage fibromyalgia symptoms? The answer is absolutely. In fact, we do a webinar on fibromyalgia. I think we did it about 2 quarters ago. The answer is yes. As you can see, using our tool, our terpene toolbox, there are a number of terpenes. Depending on the exact condition that you're trying to manage, you can actually target those. Michael, your thoughts on this? Because I think you've seen a number of fibromyalgia patients at Air, right?
Yes, sir. We have lots of fibromyalgia patients. The best thing, as you said, look at your terpenes. But there are a wide variety of products that will help with this. You can do edibles. We have, you can smoke. Lots of products that will help with not only your pain, but also just, the feelings that come with the fibromyalgia and help with the inflammation. Cannabis works great for the condition and helps. I have a lot of patients who get great relief, and their overall well-being improves.
Yeah, and I should point out that both neuropathy and fibromyalgia really break down and have done some damage to the receptors that you have in your body. CBD and THC, especially CBD, has what they call a neuroprotectant property, which means it coats the actual receptors. So it helps to be able to buffer the receptors from that pain. It won't get rid of those conditions, but it will diminish the pain and that sharp pain that you're getting, and let's just say a lot of the tension and nausea that you get and the anxiety that you get from having that particular condition. And you've seen that happen, Michael.
Yes, correct, Mark. You gotta be, you gotta really dial into your terpenes and pay attention to the product you're getting. Gear it in towards the benefits you want. Trying the wrong things and just trying to get the most THC, there are adverse reacts and you can get more anxiety and increase that type of thing, instead of, resolving your symptoms and helping cope with them.
So the answer is yes. And again, talk to your medical marijuana doctor, practitioner, and or one of the bud tenders at your dispensary that'll help you figure out the products that can help you with that particular condition. Next question is, can cannabis help with high blood pressure? If so, what kind? This is a question that I get on quite frequently. And I should tell you, let's go back and look at how cannabis works. Cannabis is distributed into your system, it gets into your system, and it helps you to be able to manage the endocannabinoids in your body and what your body produces by providing phytocannabinoids into your fatty acids. So when your body needs to produce the endocannabinoids, it reaches into the fatty acids, pulls out the phytocannabinoids, turn them into endocannabinoids, and then sends them to that part of your body that needs to be treated through your bloodstream. So what'll happen is, in many cases, when you're starting to take cannabis, especially when you first start to take it, your blood pressure will go up. It'll go up slightly. It's not going to go through the roof, but it will go up slightly. And if you have high blood pressure, it's something that you really need to pay attention to. But once it gets distributed and once it gets there, what's interesting is your blood pressure will go down. Now, cannabis is not a medicine for blood pressure. There are cannabinoids that are available that do help to reduce the amount of that helps reduce your blood pressure. That does work on that, but as a primary let's just say product to use for high blood pressure, I'd recommend sticking with your pharma drugs to do that. They'll bring your blood pressure down much quicker, and much faster. However, to start with those to get your blood pressure under control, and then move over to a product that has the right terpene profile, it will actually help you quite a bit to be able to maintain that blood pressure and get off the blood pressure medication, which is something that's really not good for you. And over time, what happens is, meaning as your body becomes acclimated to using cannabis, by acclimating meaning a week to maybe a month, your blood pressure won't go up as high when you start taking it because your body's getting used to it and it's acclimated to that. So again, I would not use it as a primary medical treatment, but I would use it as a potential secondary medical treatment. And it does have some effects to be able to help long term to help you with your high blood pressure. Now, one of the other questions that comes up is, what is the best treatment combo for back pain if it's absolutely can't take THC? I work in a hospital, so the euphoria and other drug test flags are a big one. Here's what's interesting. In many cases, a lot of the pain that you have comes from inflammation. And I'll use myself as an example. I have 7 herniated discs in my neck. I've also had both my knees replaced. And I'll use my knee replacement as an example. One night I ran out of product that had THC in it, and I was only left to use a product that had CBD. Dispensaries were closed, so I took a little bit more CBD than normal. And guess what happened? My pain went away. And when I started talking to my medical marijuana doctors and some of the consultants that I work with, some of my fellow cannabis practitioners, what we found out and what we realized is, by reducing the amount of inflammation, it reduced the pain. And if you're working in a hospital, you're on your feet all day and you're moving around, there's a good chance that what's happening is you're having some inflammation in your back. Now, I'm not saying it's the answer. I'm saying it's something to take a look at, because the inflammation may be what's causing the back pain. And if you can use CBD for that, it will help quite a bit with being able to relieve the pain and being able to stay in a mode where you can actually get the work done. Michael, any thoughts on that?
No, Mark, I agree completely with you. I will say, dispensaries as well as CBD stores, dispensaries, we carry a lot of CBD products. They may have a little bit of THC, for instance, some of our 1-to-1 products, but it's not as potent as a full THC. And if you were wanting to try something like that, Like for instance, some of our gummies are 1-to-1. We have some tinctures. You can just always start at the very low dose.
Yeah,
You don't have to take a lot to get the CBD effect. And like we said earlier, I always encourage, wait an hour or two before you take more. But I've had a lot of patients get relief without getting that your euphoric feel with a lot of our CBD 1-to-1 products, or we even carry higher concentration CBD to the THC. So.
sure. Now, here's what I don't want to do. I don't want to get you fired from your hospital job, okay? And I should tell you, there's a lot going on right now with our companies testing for cannabis products. I know that I came from California. I worked in Silicon Valley for 38 years. They do not test at all for cannabis. If they did, you wouldn't have Microsoft, you wouldn't have Facebook, you wouldn't have any of those, Instagram, none of them. All the programmers, all the folks doing all the creative work, really were using cannabis. Now, here in Florida, they talk about having very strict drug testing laws, although I've heard lately, and I'm not going to use the names of the companies because I don't want to get any people or any companies in trouble. They've significantly relaxed the amount of drug testing they do. In fact, they do some of them don't even test for CBD anymore. They're just testing for THC. Find out what drugs, what cannabis products your particular hospital is testing for. They may not be doing any testing, or they may be just testing for THC. If they're testing for THC, CBD is okay to use. If they're testing for cannabis, don't use CBD. It will show up in a test, and it takes approximately 30 days, sometimes as much as 60 days, to get out of your system. So the thoughts are, well, if I just don't use it for a week or two, I won't test. That's not true. You'll be testing for about a month, for about one to 2 months. Be very careful with that. Again, check out your HR department will tell you what tests that they do. And like I mentioned, a lot of companies have got the message that, cannabis is something that's not going to hurt the employee base, as long as they're not operating heavy machinery, as long as they're not doing anything that has to do with mechanical devices. Typically, what they'll do is they'll usually just test for THC and not CBD. Something to pay attention to. Next question is, when I go to the medical marijuana doctor, do I need proof of a condition? I had a child. Can I use medical records from childhood? The answer is yes. And what's interesting is sometimes when you go to the medical marijuana, they will actually ask you if they can pull your medical records. They'll actually pull them for you and help you be able to find out what's there. You don't need to necessarily have a condition right now, just as long as you had something in your history that's really there. And if you had a condition, even from a childhood, that warrants being one of the conditions here in Florida that you qualify for medical marijuana condition, they will actually approve that. And more importantly, here in Florida, if you have a similar condition to the ones that are approved by the state, then you'll be able to get a card as well. For example, there's over 300 different conditions that you can be treated for medical cannabis, but there's only 12 that they have on the state registry, and that's because these conditions, like for example, MS is on that list. But I have herniated discs. The herniated discs qualify, believe it or not, under the MS qualification because they have similar characteristics. And Florida's really opened up. That's one of the things they did right, was opening up the capability for the doctor to make that decision. So don't avoid going to the doctor because you're concerned about do you qualify. If you don't qualify, it doesn't cost you any money to have that visit. But if you do qualify, then you can go forward and get your medical marijuana card, which I think is really important. Next question is, why do I get paranoid from some strains but not others? Can I still use medical cannabis? This is where medical cannabis comes into play. We take into effect the fact that people do have anxiety, they do have stress, and they do react very differently to things. And so what's interesting is we can actually tailor some of the terpenes to help not only not create the paranoid condition, but also to help you taper that down. So the answer is yes, you can use medical cannabis. Michael, you've seen this in your working in the dispensary, is that correct?
This is correct, Mark, and just because of my personal history with this, I am the perfect patient that has to be very careful on the strains and the terpene profiles that I'm partaking in, just because I am somebody that has high anxiety. And I have found that there are certain terpenes I need to stay away from. As we said before, this is the perfect scenario to pull up those certificate of analysis,
Mhm.
and you can review that. Look at the certain terpenes that are going to be more relaxant, anti-anxiety. It's not always a given, but generically, the terpene profiles on your sativa strains are more likely to activate the paranoia and the anxiety. But I've also had patients that having anxiety and they can tolerate those. Me
Sure.
personally, I cannot. But like I said, the best thing, make a journal, look at your COAs, ask your bud tenders. We work with a lot of different patients and we pay attention, we learn from experience. So we can look at what's worked for us or other patients, and then we can look into your terpene profile. And once you develop your specific terpenes that work for you, it makes it really easy to find other products that contain
Sure.
those, and develop your treatment plan.
Sure, and that's really, really important. Next question is one that's good, and it brings up an important point. It says, if my treatment is a specific strain, what guarantees that the strain that's sold commercially is the real deal? Well, first of all, I don't prescribe or recommend people look for specific strains. I recommend people look for terpene profiles. The reason for that is because cannabis is a botanical product, meaning it's grown. And so if you grow two roses in a garden, they may look alike, they may smell alike, but they're going to be a little bit different in the way they grew based on the temperature, based on the light, based on where they are. There are slight variations in the product itself, but you'll still have that terpene profile. Sometimes when so a strain, which is referred to the cannabinoid, will then be tied to certain terpenes. And if you find the terpenes that work for you, you can actually use another strain that has that terpene profile that'll match and be able to help you with your particular condition. That's what's key. Now, you heard a term being used called cultivar. What is a cultivar? A cultivar is a match between a strain and the terpenes and flavonoids for a specific reason, like, for example, sleep or arthritis or pain or anxiety and stress. I really believe that within 5 years, you're going to walk into a medical cannabis dispensary and you're going to ask for a product for pain and they'll have them on the shelf. Literally, that's where we're headed with the genetics of the cannabis strains. But the answer is look for cultivars, know your terpene profile, and then you'll be able to get whatever products that you need to address your particular condition. Now, when you ask, is it the real deal? In many cases, strain that you're using had a terpene profile really helped you with that particular situation. That's the real deal. The real deal is making sure that you have the terpenes and the flavonoids that match what you're really doing. Mike, your thoughts on that?
And I will add in, Mark, as you said, prime example. I used to be somebody who always went more hybrid and indica. But as we said, these are plants, they're cross-pollinating. You can't just go by the specific strain and or the ideal effects that it's supposed to give off. I've had products that were hybrids and they reacted bad with me, and
Mm-hmm.
this was prime example. I was not looking at the terpene profiles and was not seeing there may have been a few extra terpenes that I didn't tolerate well. And this is really common with a lot of patients. As we move further into technology, this is something that everybody needs to look more into rather than just off of, where we went several years ago and
Sure.
I need energy, I'm gonna get a sativa,
Sure.
or I like both, so I'm gonna do a hybrid. But there's so many different strains now that
Right.
that's not a good
Well,
that's
and the
not a
reason
good
there's so
way
many
to
different
go.
strains is because what they're doing is they're creating these cultivars and they're looking at the cultivars, and as they're creating different cultivars for the different conditions, what's happening is they're being marketed as strains, a Jacare or something like that. I do want to point out that I want to actually back up for a second. I when I got my training as a cannabis practitioner, I got it from outside the state of Florida, and I was told that we could use medical marijuana. You can use medical records, any medical records over your lifetime for that. I was just corrected by one of our staff that it turns out that here in Florida, your medical records have to be no older than 3 years old. So I gave some bad information on the last question that was asked about being about the actual medical records. If you've seen a doctor and you have that condition diagnosed within the last 3 years, then in fact you can get your medical marijuana card. If you can actually pull the medical records or bring the medical records from when you had as a childhood, you can actually sit down with a doctor and he'll actually update your medical records for that. So I hope that really helps. And I'm sorry I gave out some bad information. Again, it has to do with state of Florida. I wasn't aware of that particular requirement versus where I've been trained. So thank you very much for that particular correction. Any questions, other questions that pop up? Are topicals a good route for, oh boy, I don't know if I can pronounce this, alloidynia pain, and what terpenes do you recommend? I'm not familiar with alloidoia pain. Michael, are you?
Not in particular.
Yeah, I'm not familiar with that type of pain. I can tell you though, pain usually comes from the receptors being stressed, and what ends up happening is the strains end up getting into a situation by being stressed, they produce the pain that's there. Now, I do want to point out that down over here, you see the little blue arrow. It's talking about a type of nerve pain that's really there, where where it actually is almost like a neuropathy type of thing, where when you're wearing, you feel pain when you're wearing clothing, getting tapped, you get tapped on the shoulder or something like that. That's very close to neuropathy type of pain. And the answer is yes. Cannabis works very well for that. Again, it goes back to that whole condition of that CBD produces, which is your neuroprotectant capability for the receptors, and it works rather well. I've seen people with a lot of different with fibromyalgia, with MS, with neuropathy, get some very good relief using medical cannabis, and I suspect it's something that falls into this category as well. Michael, you've seen some people with severe pain react positively to cannabis as well.
Correct, Mark. And the
I think you're one of them,
topicals,
right?
yes. So, I've been a dancer for years. I've used topicals on my knee. If you're somebody who just, you get a kink in your neck and it's one of those ones where you can't even, turn around in your office chair. We have wonderful balms. Specifically, my favorite is our one-to-one with THC and CBD. So
Hmm.
you're getting the combination of the THC that helps with your pain, and then as well as CBD inflammation results. And it just really, really has helped me and a lot of people make it through their daily activities. It's worked for a 6 to 8 hours shift, which, advised isn't really as, it normally, or, they say it doesn't even work that long.
Hmm.
But out of personal experience, it's definitely helped. There's patches out there. So I would definitely recommend THC and cannabis for pain, as well as any products with CBD.
Right. And I want to point out something on this chart that's really important. You'll notice in the recommended terpenes, linalool is in there. You'll notice on the terpenes to limit, linalool is on there. And that's because linalool is part of a group of terpenes, which includes beta myrcene, terpinolene, germinal, and boronol, that are what they call sleepy terpenes. These are terpenes that will help you relax and may even help you go to sleep. Now, that is something you may not want to do during the day when you're trying to be active. It is something you may want to do in the evening just before you go to sleep. So again, we talked about the biphasic effect. We talk about what these do. This is where you can use it for one thing and you can use it for another. But again, it depends on the environment you're using it in, the timing that you're using the product, the route of administration. A lot of that comes into play that's there. But it is important to understand things like beta-caryophyllene, things like limonene work very well. Now, I also want to point out pinene is a great product for pain. Pinene can also bring back short-term memory. So if you're suffering from PTS or PTSD, please be careful about using pinene. It may not be something that you really want to take a look at. Let's jump to the next question. Interesting question. Can I use DNA testing kit for personalized wellness? There's a lot of studies that have been done. When I was doing my medical research, there's a lot of studies that were done to trying to link DNA to a number of conditions and what we should and we shouldn't be using. I know I've had a number of folks come to me and say, well, we can do some testing and find out what cannabinoids and terpenes can be used for you. I've not seen any of those work right now. I think they're working on it. I think that's a work in process. I think it's something that people are taking a look at, but I'm not aware of a DNA test that will help you figure out your personal wellness. That doesn't mean it doesn't exist. I'm just not aware of it. And it's something that you may want to take a look at. I do know that DNA is really trying to tell you what's going on within your body. Obviously, they use it for a lot of things like crime labs and things like that. But I think there are studies, there are people doing work. I've actually been talking to a group in Israel that's done some work on this. But again, they haven't got any breakthroughs. They think they're heading in the right direction. But again, there's a lot of testing that still needs to be done. And if there is, by the way, so let's go to one is what is the best products for persistent insomnia? So I want to jump into this for a second. Sleep is very important. And when you take a look at the right products for sleep, what you really want to pay attention to are products like linalool, which relax you quite a bit, myrcene, which does a great job to relax you. Those are products that are the terpenes. Again, when I say about products, I really should say terpenes and not products, because those are the types, those are the profiles that you should really take a look at. Insomnia is something that is persistent for a lot of folks. Again, the myrcenes, the linalools, again, that has to do with lavenders, get you to relax and really help in that particular area. Now, I also want to point out that the route of administration is really important. What I mean by that is that you have a situation where if you use, like for example, an edible, I'm a chocoholic, so I like to take chocolates before I go to sleep. Obviously, I have cannabis-based edible chocolates, and then I make my own magic brownies for sleep. They'll last a good 8 hours. So about an hour or two before I go to bed, if I take a brownie or a chocolate piece of chocolate, what I'm able to do is I'm able to go and get some sleep and stay asleep for 8 hours. It does a really good job for that. So it's not just a matter of making sure that you have the right terpene profile, but also make sure you're using the right route of administration. Because if you use a tincture drop, tinctures will work between 4 to 6 hours. Take it at 10 o'clock or 11 o'clock at night, you're going to wake up at 4 or 5 in the morning because the product is worn off. And that's where you're waking up in the middle of the night and can't get back to sleep. So again, route of administration is really, really critical to being able to figure out, which products will work for you. Again, I lean towards the edibles for the evenings because they will carry through the night. But in many cases, having a vape pen or smoking a joint helps you fall asleep right away. It works right away. That's really out there. Michael, your thoughts on this?
No, Mark, I will just add, it's honestly, as you said, finding a combination. My experience with patients is more of our edibles, our capsules, of course, like RSO syringe, you can eat that, put some of that on a piece of candy. Of course, personally, I will do some edibles and maybe hit my vape a little bit or smoke a little joint before bed, just
Sure.
to unwind and relax. At Air, we actually have a lot of products that have CBN, the
Mhm.
cannabinoid CBN, which is really good for sleep. And helps you stay sleeping and also has an effect of helping you wake up relaxed, calm, well rested.
Sure.
Now, keep in mind though, if you are doing edibles and or capsules or something, start out slow because you don't want to wake up half groggy because you ate too many edibles
Sure.
or had too many capsules. But
Right.
uh,
Again, be cool. Just be cool when you're using edibles. That's all.
that is correct. Start
Cool.
slow, work your way up. If you're somebody who's just starting out, don't take a full 10 milligram gummy. Either cut that into quarters, or if you've taken one before, you can probably try half. If
Sure.
you're, like Mark said, tincture might not be your best option unless you're taking a significant dropper full, just because it wears off a little quicker.
Yeah. Four to
But
six
of
hours is
course,
what it typically does. Yeah.
but your edibles, your 30 milligram capsules, those CBN, THC and CBN gummies, those
Sure.
work really well. So there's a lot of options out there for
Yeah,
you.
and I should point out we have done webinars with Dr. Greg Holt on sleep. And if you go to our YouTube channel, which is YouTube/marijuana aware, you'll find a number of our videos that are out there and take a look at the videos on sleep. I've done 3 or 4 videos with Dr. Holt on sleep. In fact, we'll be doing one in the next quarter or the quarter after. I have to figure out the dates exactly. We have that scheduled. But we do sleep is one of the main reasons to use medical cannabis. People use medical cannabis, and Dr. Holt helps us to be able to explain that and be able to move forward. And there is a video on that. And not only is there a video on medical cannabis for sleep, I also have a video on the YouTube channel on just sleep in general. Dr. Holt gives a great dissertation on sleep, how to help you get better sleep, how to manage it, and how to really improve your life by using certain techniques that he's been able to come up with. And by the way, Dr. Holt was the head of the Sleep Association here in the United States for about 4 years, and he actually just resigned that last year, basically due to time. And he still is very, very active in the sleep industry, in the sleep community. So please feel free to check that out. Now, next question is I can relate to this one. I have 3 relatives who have type A personalities. None of them get positive effects from cannabis. Is it because of their personalities and genetics? Well, that could be a factor. There's no question that genetics does have a factor in whether you're getting positive effects from cannabis. But my bet is, being its type A personality, they're smoking it, they're using recreational products, they know it all. And what's happening is they haven't gone through the dosing to find out what their sweet spot is. They probably don't know what their terpene profile is, meaning what they should be using. And in many cases, when we talked about that dosing profile, where when you're going low and going slow, you get to your sweet spot, you feel relief. Then you go past that, you get the negative sides of cannabis. What's interesting is, by being a rec user, they don't recognize that they've gone past their sweet spot to that area that's not necessarily comfortable. And I would suspect that they're in there. I'm just preparing for our next webinar, which is on cannabis use disorder and cannabis hyperemesis syndrome. We talk about those. In many cases, many of the people that have CUD and CS, cannabis hyperemesis syndrome, CHS, have actually gone past their sweet spot and gone into that territory where it's not feeling comfortable. Their concept is more is better, and that's not the answer. The problem is more will kick in that biphasic effect, which gets you to that negative side of cannabis. And that's what's happening with a lot of folks as they don't understand cannabis. They're not necessarily working with a doctor on the medical cannabis products. They don't have the right terpene profile. It could be they don't have the right terpene profile. And also, they don't necessarily understand the right route of administration. For example, to use a heat setting of 356 as opposed to just the hottest blunt, that just lighting a blunt and smoking it. Those are all key factors. And I would suspect if they sat down with a medical professional who knew medical cannabis, somebody who knew the endocannabinoid system, a medical cannabis practitioner like myself, and someone you'll find at the MMTC clinics, they can help them, direct them to the products that'll help them. And I think, Michael, in your clinics, you can actually help people identify the terpenes and the products that'll help them to be able to relax and get the benefits that they're looking for. Is that safe to say?
Correct, Mark. So we can look this information up on the registers. We can look up the percentage overall of the terpenes. Because I'll be honest, I was from experience, I was one of those patients first starting out. I thought to get the best benefits, you want the highest THC,
Hmm.
you want to get the bigger hits, the hottest heat setting. And what I found is I was one of those patients that was having the adverse reaction of overdoing it with the THC and not
Right.
paying attention to the specific terpene profiles. And it really, when I started dialing into all of that information, it really changed my view overall of cannabis, because I was thinking maybe I was one of those people that I couldn't tolerate cannabis anymore. But it wasn't the fact. I studied more. I looked up my terpene. I found terpenes that worked for me. I did the trial and error. I made a journal of everything I tried. If and I
Good.
found out by helping a lot of patients too. And from my experience being in the dispensary, a lot of patients got a lot bigger benefit on their products that had lower THC and
Right.
higher terp levels.
Right. And that's what's really important. If you go through the process of going through your dosing regime, finding out what your tolerance is, going low, going slow, finding out where your tolerance is, and really backing down to where you find that optimal, that sweet spot that's there, that, and also paying attention to the routes of administration, you will find, and also being able to look at the terpene profile, cannabis will work for you. That's the medical cannabis process that we go through. It'll work almost every time. If you bypass those, that's where you kind of get into some issues that are out there. And again, as someone who's been in this industry now for almost 10 years, most of the folks that come to me and say cannabis doesn't work or I'm having problems working with it, we find out they don't know their sweet spot, they don't have the terpene profiles right, they're using the products incorrectly, they're not using the right routes of administration based on onset and duration times. By correcting all that, it makes a huge difference. It goes from something that, gee, I don't know if I can use it, to this helps me get my life back. And I think you're an example of that, Michael.
Wait, say that one more time, Mark.
I'd
I'm
say
sorry.
by being able to go back and do your dosing, finding your sweet spot, identifying the terpenes, you now have had you went from this isn't going to work for me to finding out that this is not only going to work for me, it's something that's very important for me to have in my life to help me get my life back.
Correct, Mark. And it was something, I struggled with it for quite some time. Most a lot of the doctors don't necessarily give you as much of this information that you provide with us. That's
Hmm.
why this webinar is so awesome and great for patients, because if I would have had this information when I first went into the dispensary, I may have not experienced some of those effects. And, for me and my personal history, it would have been a lot. Um, it would have made my process a lot easier. But fortunately, I actually went to AIR and I met somebody who was really educated, and they helped me pick the right products. They helped me gear into the benefits I was wanting, and with all of the starting slow, tracking making a journal of what I tried, what worked, what didn't work, gearing into my terpene profile. I have developed a game plan that works for me, and I help patients do this daily, and I recommend this process for anybody.
Well, listen, Michael, we have covered a lot of territory. We've covered a lot of information about medical cannabis. And hopefully, if just one person can watch this webinar and be able to get their life back, we've accomplished what we wanted to accomplish. And naturally, I want to have more than just one. But our goal really is to really educate to the point where you're now using not only cannabis correctly, but you are controlling and managing the symptoms that you're really trying to address. Michael, last questions about air. You have some discounts on here. I think that everybody loves discounts. Tell me about those.
Yes, Mark. So we have some great patient loyalty programs. We are one of the only dispensaries across Florida that give you 50% off visits. They make our products really affordable, actually cheaper than most of our sales. Of course, we're always running deals. We have a loyalty program. We give you 75 off of 150, or half off for your card renewal. And then, of course, we have special discounts for our veterans and seniors. We also have a great point system. We have, you can go on the AIR website, you can view our products.
Hmm.
Uh, I will add in, if you register for our loyalty program, you do have the opportunity to get an extra stackable five. And then also, of course, anybody who watched this video tonight will get a stackable, or anyone who participated in any of the webinar will get a stackable $5 coupon
Sure.
that
That's great.
stacks with these discounts.
There you go. Well, Michael, thank you very much. We've gone through a lot of information tonight. Can you give me any final thoughts you have on this particular subject?
This was a great webinar, Mark. I think this is something that a lot of patients, a lot of us, including myself, struggle with. And this information really, you know, guys, this is an asset. Use it. Take what we're saying. Look at your terpenes. You know, start slow. And you know, I'm excited to see the benefits you get as Mark and myself and many others have received.
Sure. Well, Michael, thank you very much. We really appreciate your contribution, your insights, again, sharing some of the scar tissue with us on your adventures with medical cannabis. I want to point out if you're looking for a medical marijuana card, I recommend the Medical Marijuana Treatment Clinics of Florida, mmtcfl.com. They have 22 locations here in Florida, but more importantly, they're not just doctors that get you a card. Once you get that card, you got to figure out what to do with it. And this is where they have dosing, an online dosing center to help you. The practitioners will help you be able to figure out how to take that regimen and turn it into something that really helps. We have discounts that we help push to the different dispensaries that are there. And more importantly, you have a telephone number and support for your medical cannabis journey, right down to the point where we actually send you emails twice a month to really help you walk through that whole medical cannabis program. It's not a matter of getting your card, it's a matter of getting the right information, tuning it in, and being able to move forward. And that's what I like about MMTC. They're the only ones that I know of in not only Florida, but in the United States that do that. One quick, you see something here about the blunt joint. This is a Manny Alvinus. The Manny can't join us tonight, but he has a great practice that really helps as a medical cannabis practitioner. He can help with a lot of services. He has a lot of experience in the medical cannabis field. And then I want to mention naturally our program, Marijuana Aware. Please check out our YouTube channel. And please not only like, but also subscribe. There's a wealth of information that's out there that can help not only just about what we talked about tonight, which is how to personalize your treatment, but we have snippets. We have how to go through your journey. We have routes of administration, fibromyalgia, arthritis. Please feel free to check that out. And then next June 4th, our next webinar will be on cannabis use disorder and cannabis hyperemesis syndrome. Very important. I know people talk a lot about them. I want to be able to not only have people understand what they do, but I want people to understand these are conditions that, first of all, can be managed. They do exist, they can be managed, and they actually are something that can be not only overcome, but can be prevented. And so that's what I want to be able to point out to a lot of folks. And I think it'll be an interesting webinar. Thank you for joining us tonight. I want to be able to say that if you have any need for medical cannabis, please check out not only our webinars, but please check out our YouTube channel. We'll be more than help you hopefully get you the information that you need to get your life back.